करूँ शेयर? यही वाला पेज है। 21 आप एंटर करो तब तक मैं आपके फोन से ज्वाइन करूँ।
Okay, I'll see if we can cancel the break and finish the class soon there. Okay. We are moving on to the next one, which we have earlier also done with you. That is insulin, children. We have done a bit about insulin. The structure of insulin you will study next year in class 12. Very interesting structure is there of insulin, but as of now, let's do this peptide hormone. Beta, is my voice clear?
Your voice is echoing.
That is what I also felt. There's an echo. Now is it okay? No, still we have an echo. You people continue. I'll join again.
Ma'am, your mic is on.
Ma'am, actually, your both mics are open.
Yes. Now I suppose it's okay. Correct now?
Yes, ma'am.
Many things now. People of my age especially. Yes, beta, we'll move on to insulin. This peptide hormone plays a major role in regulation of glucose level in the blood. You know about insulin. It mainly acts on hepatocytes and adipocytes. What are hepatocytes? Intentionally, I did not explain this word. Just now this word had come. What does it mean?
Liver cells.
Very good. I did not explain at that time. I did not even discuss about that. That is adipocytes. What are adipocytes?
Fat cells.
Yes, cells of the adipose tissue. Very quickly tell me the two types of cells on which it acts on insulin.
Hepatocytes and adipocytes.
So this will increase the cellular glucose uptake and utilization. Here the glucose level is increasing the uptake or it is decreasing? Okay. And what had happened in the previous one?
Decreased uptake.
Yes. When the uptake was decreasing, then the amount of glucose level in the blood sugar was increasing or decreasing?
Increasing.
Obviously, if the cells are not taking much, then it is increasing. Here, if you see, it is just the opposite, beta. What is happening? The uptake is increasing or decreasing?
Increasing.
What will happen to the blood sugar level? It will increase or decrease?
Decrease.
It will decrease. So this is how insulin works. How insulin works? It will increase the utilization of glucose by the cells, special cells, not all the cells. Which are the two types of cells we just now discussed about?
Adipocytes and hepatocytes.
So what will these cells do?
Increase the
Increase
cellular
uptake.
Excellent. They will increase the uptake. They'll start utilizing more of glucose. So when they're utilizing more of glucose, obviously the blood sugar level is going to go down in the cells, and this will decrease the blood glucose level. And what is this new word coming your way? Please read this. Hypoglycemia. What is this word over here, children?
hypoglycemia.
And what was the previous one where we had higher glucose level?
Hyperglycemia.
Jaldi se we are going to revise hyper and hypo. In hyperglycemia, glucose level is increasing or decreasing?
Increasing.
Decreasing. Beta, hyper, not hypo. In hyperglycemia, what is happening? Increasing or decreasing?
Increasing.
Increasing.
It was increasing because what about the cells? What were they not doing?
Cellular
uptake.
was less.
Cellular
Uptake.
glucose uptake.
Yes, very good. And that term was known as hyperglycemia. And now there are some special cells which can increase the uptake. We discussed about these two cells. Name the cells.
Hepatocytes and adipocytes. Hepatocytes and adipocytes.
Okay, what will these cells do?
Increase the
Increase
utilization.
the glucose, cellular glucose uptake.
So obviously the amount of glucose in the blood level will go down, and such a condition is known as.
Hypoglycemia.
Hypoglycemia.
See, Beta, we are almost nearing the completion of these two glands which are in the middle, and then we'll only be left with the last two glands, that is 6 glands. So one type I have done in one day. So after I told you these are the two glands which are located together. What are the two glands we had done together? Can you tell me which are the ones which are
Pancreas
located?
and adrenal glands.
And pancreas.
Yes. So we are going to complete only pancreas today. The other two, the these set glands, we are going to do tomorrow. So we have done a sufficient amount of this. This is something deficiency order of insulin, diabetes, diabetes mellitus. This is the common complex disorder caused due to prolonged hyperglycemia. Sometimes what happens is hyperglycemic condition comes for 1 day, 24 hours or something. You've eaten something excess of this and it is caused. Then we don't call it as diabetes mellitus. We are going to call it as diabetes mellitus disorder only when it consists for a prolonged hyperglycemia condition. Beta, is everybody clear the difference between hypo and hyperglycemia?
Yes, ma'am.
The causes also? Are you okay with the causes also?
Yes, ma'am.
Okay, let's talk about this deficiency. Diabetes mellitus is associated with the loss of glucose when complete glucose cannot be reabsorbed by the kidneys in the urine, as pancreas fail to release adequate amount of insulin to lower the level of glucose in the body. Actually, what is happening is the glucose level is not being lowered down in the body. Who is failing to release this an adequate amount of insulin? Pancreas. So what happens in this disorder? The cells fail to utilize the glucose. Just now you had discussed with me the cells are not able to utilize glucose and for producing energy. Instead, they start using proteins and fats for getting energy. Normally, glucose gives us energy. Agreed, whenever we run athletics or something, immediately to give you energy, what is given is glucose. So the conventional way out or the normal way out is it is glucose which is going to give you energy. But in this order, what happens is the cells, they cannot utilize glucose. They cannot convert glucose or break down glucose to give you energy. So they start utilizing proteins and fats. So the proteins and fats, if the cells start utilizing, the person will become weaker and weaker. See, two things will happen. One side, the person is going to become weak. Why is the person becoming weak? Because the fats and proteins are being used for producing energy. And second reason, the amount of glucose is going to rise in the blood. Diabetic patients are successfully treated with insulin therapy. We can easily treat them by giving them artificial injections of insulin. What will the insulin injection do in the body of a diabetes person? See, what is it going to do? It will stimulate the conversion of glucose to glycogen in the target cells. It is going to convert your glucose to glycogen. It will decrease gluconeogenesis. Now let me see if you remember this term. Tell me, what was gluconeogenesis?
Synthesis of glycogen into glucose.
Gluconeogenesis and glycogenolysis. Both the terms have come together. So no confusions. I want the first one, beta, first. Gluconeogenesis, tell me fast.
Synthesis of carbohydrate from the non-carbohydrate sources like amino acids and glycerol.
If you see the last condition which I told you here, that the cells fail to utilize glucose and rather they start utilizing proteins and fats for energy. If you remember, we had done this yesterday. This was gluconeogenesis. And the second term which I've just done with you is glycogenolysis. So please do not get confused between glucogenesis and glycogenolysis. Now tell me very quickly, the class is going to ever get over. What is glycogenolysis?
Breakdown
Only
of
girls are
glycogen into
class.
glucose.
Boys don't speak at all. Always mute. What is wrong with boys? Why don't you people speak out, beta? I always get response from girls. Why don't you guys speak out? Ha, beta, girls. Can continue. Give me the answer. Batao, beta. Tell me glycogenolysis. What is glycogenolysis?
Breakdown of glycogen into glucose.
Okay.
Breakdown of
Get some,
glycogen into glucose.
yes, my child, get some energy. Few minutes left for the class. I know this is the last period is difficult for you. It reduces the catabolism of proteins and fats. What is catabolism?
Breakdown.
Breakdown.
What is the opposite of catabolism?
Anabolism.
Okay, now we are moving on to the last function of insulin. It's going to increase the synthesis of fats in the adipose tissue from fatty acids. So, a lot of fat stored in which tissues?
Adipose tissue.
Adipose tissues.
Excess fat of the body stored in adipose tissue. So, it will synthesize fats. So, our topic for today is done. We are done with the target that we had today. Few minutes left, very quickly. We had done about which gland today? Now, boys, please speak out. I'll mark all of you absent otherwise. Which gland is done today? Akash?
Yes, ma'am.
Akash, speak out. Tell
I'm
me which
Adrenal
gland.
gland. I'm Adrenal.
Okay, adrenal. Let me revise pancreas with you today. This is more important because pancreas acts like both exocrine and endocrine gland. So pancreas is also known as which gland?
Heterocrine gland.
Yes, excellent. It is known as heterocrine gland. Two good children. Pancreas consists of how many groups of islets of Langerhans cells?
3.
3.
What is the first type? What is the first type?
Alpha cells.
Alpha
Alpha
cells. Name the hormone secreted by alpha cells.
Glucagon.
What is the hormone secreted by beta cells?
Insulin.
Insulin.
Which is the third type of cells we have?
Delta
Delta
cells.
cells.
Earlier they were known as
Gamma
Gamma
cells.
cells.
gamma cell. Very good. These D cells, these delta cells, they secrete these PP cells or F cells, which secrete what? Which PP hormone? What is PP?
Polypeptide.
Okay,
Pancreatic polypeptide.
then we came across a condition, hyperglycemia. What is hyperglycemia? What increases in the sugar? Sorry, what increases in
Blood sugar level. Blood sugar level.
Okay, now we come to the insulin. Basically, which two kinds of cells we talked about? It acts on which two kinds of
Hepatocytes
cells?
Hepatocytes and
Hepatocytes
adipocytes.
and adipocytes.
Yes, very good. And then automatically there's a decrease in the blood glucose level, which is known as
Hypoglycemia. Hypoglycemia.
children. If you want, I can do one thing. If I'm absolutely okay with both the cases. If you want to break up 10 minutes and then continue with the last class, then also I'm okay. If you want to wind up earlier by 1:15, I can start without a break and finish by 1:15. Now it's your choice. You can decide what you want. You want a break of 10 minutes before the last class and then pull it till 1:30, or you don't want to want a break and finish it by 1:25. Girls, you people decide. And one boy, Akash, is also there. Others have almost left. So this is going to be difficult if it's the last class like this. Decide, beta, how do you want? You want to continue with the same manner?
No, ma'am, remove the break.